don't have any time for any gossip now. Eh?
I was pregnant already, expecting my son. When I was looking around and asking friends at the time for OBGYNs, everybody recommended Dr. Jackie. So, of course, I didn't know who she was, but I'm like, well, she got to be good if all y'all are going to her and there is no connection between these ladies that recommended her. So let me go to her too. Long story short, my son ended up being a stillbirth 36 weeks in my pregnancy. 3 days after I had had my appointment with Dr. Jackie. The day that I had my appointment with Dr. Jackie, my son was measuring to be a little bit smaller, and she shared some concerns about that. So I went from her office to the maternal fetal specialist at Northside because that's where I was intending to deliver. Baby, long story short, they did not decide to induce me or do anything any sooner like I thought that they were going to, because she made it seem like I was about to go into labor like soon or be hospitalized. 3 days later, I'm having these pains. I'm thinking they're Braxton Hicks. I didn't know what was going on. So I called Dr. Jackie's office to let them know. I'm told, drink some orange juice, keep doing this and that. So that's what I did. And it still didn't feel well. A couple hours later, fast forward a few hours later, I'm at the hospital. I'm a couple days shy, 37 weeks pregnant, and I'm told that there is no heartbeat. And I am broken. I had to go into an emergency C-section and be put to sleep. I was internally bleeding because my baby was blocking all the blood, and my son ended up passing away when I was 36 weeks in my pregnancy, and I almost passed away too. So to hear a woman, I've been quiet about this story for a very long time. And when my mom touched down into Atlanta, my mom had a lot to say to Dr. Jackie, a whole lot to say to her. But to hear a woman like that, of her caliber, of her demeanor, make such a poor comment that black women cry wolf, like, that is unacceptable. It's one thing to be somebody on the outside looking in, but it's another thing to have experienced her. That was actually the first black doctor I've ever had. And to be honest with you, I think that's been the last. Not intentionally, but that's just how it's gone. And now I'm a stage 2 breast cancer survivor. So I'm checking off baby loss mom. I'm checking off breast cancer. And I look back and I'm just like, wow, like, how could you say something so negative like that, so hurtful like that, especially to us whose children didn't even make it here under your care. And I'm not blaming this on her per se, but I'm just like, there was so much opportunity in that process. And she said to my mom, had I made the right call, had I trusted my first judgment, because her first judgment was to just go ahead and induce me the moment she felt like he was measuring to be a little bit smaller. That was her first judgment. And because she did not decide to do that, he literally passed away. 3 days later, I had a placenta abruption out of nowhere. And I left that office being told, oh, you're you're in the less than 1% percentile of stillbirths. You'll be fine. Nothing's wrong. We're not even going to worry about it. He may be a little bit smaller, but he's okay. He seems healthy. I got an autopsy done on my son, and he was healthy. He was a perfectly healthy baby boy. I have been quiet about this for.
So, guys, we are back here again with the Dr. Jackie and her patients still coming out. This particular lady stated that she actually, had visited Dr. Jackie in the days before her son passed away. Now, interestingly, she did state that Dr. Jackie felt like she needed to be induced, but for some reason, it never took place. as you guys hear her in the video, she stated that, she had started having pains. And for some reason, after reaching out to Dr. Jackie and her medical team, they told her to drink orange juice. Now, here's the situation. Obviously, I'm not a doctor. I know nothing about anything related to this. But if she felt like her patient was at some sort of a risk and felt like she should do, I think she said an emergency C-section, and then for some reason it didn't happen, but now this same patient is calling you saying that she's experiencing pain, but you tell her or your staff or whoever, because you would be responsible for whatever your staff states. But clearly, she had to have notification of this, and you tell her to drink orange juice. I'm not understanding where the disconnect is here. I'm just not understanding. Um, this is the issue, though. I feel like these stories are going to consistently come out and come out and come out. Again, I believe this lady may go by the name of Renee. I'm not sure of her name, but she did say she was about 37 weeks. And she stated that she went in to Dr. Jackie. She was recommended to Dr. Jackie by a lot of people. However, her experience was obviously terrible. I believe she mentioned in this video that she didn't want to blame Dr. Jackie, but she did use some very good choice words. She said that there was opportunity, and I have to agree with her, because if a doctor feels like she should do an emergency procedure and then decides not to do it, but yet that patient now is calling in saying that she's experiencing pain, but for some reason you cannot get that patient in, but you tell her to drink orange juice. I don't know. That just seems like negligence to me. So again, I'll just, continue to talk about this and post these as they come available. But this is very sad. I know I spoke to you guys about a petition. I have not forgotten about it. This weekend I should have more time to research it and get it up and going, because this is a disaster. When we as Black women decide to choose a Black doctor, this is not the service we want. And this is just me speaking. I don't have any factual information, but I'm going to say this. I feel like some of these Black doctors are booking patient after patient. And I'm going to tell you why. The more patients you get, the more money you receive. I've experienced it in other practices, Black doctors, where you go in the waiting room and it's tons of people and they're just waiting and waiting. So I don't know what's going on, but I do know a lot of people are coming out with these similar stories. And, obviously, with all the controversy surrounding her, everybody is feeling like this is their opportunity to speak on their experiences. Again, you guys let me know what you think in the comments, and I will see you guys in the next video. And don't forget to like, share, and if you have not, please make sure you subscribe to my channel. And as always, let me know what you guys think in the comments.